Joining us live is Jennie Hudson, the Director of Research at the Black Dog Institute. Jennie, appreciate your time. What is your expectation about announcements in the mental health space tonight?
We're hoping to see that the government is really committed to mental health, and not just mental health of older people, but also the mental health of children and young people. We see that as a really critical area that we would really like to see that focus on young people. And when I say young people, not just adolescents, but where we're focusing also on mental health of children. And that's often an area that gets missed out on in funding. So that's what we're really focusing on. And particularly at the other end as well, workers, we're really hoping that we see a commitment from this government to really support the first responders across the traumas that we're seeing at the moment through COVID, but bushfires and floods as well, supporting those workers in that space.
Well, we are speaking, of course, on a day when, yet again, locals in Northern Rivers areas and in Lismore in particular are being told they need to evacuate again just a month after those terrible floods. Between the flooding and the bushfires, and you mentioned, not to mention the pandemic, Australians are going to need more support going forward, aren't we? Are we prepared for that at the moment?
Yeah, I think what we know from research too is that it's this accumulation of traumas that really has an impact. Maybe we can bounce back from one trauma or one really difficult event, but when it's this kind of constant, flood after flood or flood after bushfires, after COVID, then that really does have an impact. And we really do need to consider and prioritise the mental health of both young people and individuals across the lifespan, so that we have a mentally healthy workforce and we have a mentally healthy community as well, and that we're investing in mental health and not just other areas of our community.
Jennie, much has been said, as we know, about our children's mental health after long periods of lockdown and no schooling or socialising. Does screening for those problems happen in schools already? How are you suggesting we try to catch some of these kids before they do fall through the gaps?
Yeah, screening doesn't occur at the moment, or we don't really have those services, particularly in primary schools. There are some services in high schools, but it's kind of not particularly consistent across Australia. And at the moment, children are falling through the cracks, and they're not getting the services that we need. That we know that children do experience mental health difficulties. And for some difficulties like anxiety, they're just as likely to experience it as adolescents. But yet those services are not available in primary school. So what we're calling for is some mental health checks for primary school students so that we can catch it early and provide intervention for young people, and not only just identifying it, but then also connecting them to the right care at the right time, because we see that as such a critical component of being able to support a mentally healthy community, that providing intervention early for those families that need it, to hopefully then put the child on the right track so that they can be productive throughout their lives.
And Jennie, looking more broadly at the impact we've seen from the pandemic on adults, I mean, obviously it's not normal human behaviour to be locked away from friends and family and colleagues. We're all now edging back out into the world. Are we seeing an increasing number of Australians struggle with that? And are you finding that PTSD is a real problem, that a lot of adults were able to push through the immediate crisis, but now are starting to struggle?
Yeah, what we are seeing is across the lifespan for children, young people and adults, an increase in anxiety and depression and just this kind of psychological distress that people are experiencing because of this accumulation and the impacts that it's had. And we are seeing that increase. And also at the moment, just not having, there has been some really great initiatives to try and support and improve their care, this mental health care, but it's not quite cutting it yet. We need more supports and more effective supports at the moment. People are not receiving evidence-based care, and the treatments that they are receiving are perhaps not the ones that are going to produce the best outcomes. So that's what we're hoping to see from the government, some choices being made that are led by science and the evidence, and being able to provide treatment for those people that need it, and also affordable treatment. So it's really costly to see a psychologist or a paediatrician or a psychiatrist, but those Medicare supports are really critical to be able to get those services. And we're also proposing a service for first responders as well, where we can deliver free services on top of what the government is providing in their 20 Medicare rebate sessions as well.
Jennie Hudson, not long to wait now. All will be unveiled in the next few hours. We'll be looking closely at what announcements are made in this space. Appreciate your time. Thank you.
It's a pleasure. Thank you.